Neuroendocrine tumors are a very rare subtype of solid malignancies that have, however, become increasingly prevalent because of our awareness of this particular subtype of tumor. However, there is a real paucity of molecular targets in this particular disease area. So, for example, in slow-growing, low-grade neuroendocrine tumors, there are somatostatin analogues that can potentially be utilized for treatment, but then patients would invariably progress. And I think there is a delicate balance that has to be met in managing these patients that have long-term survivorship from their cancer. Occasionally they can be symptomatic from a carcinoid syndrome, but at the same time they do require adequate treatment for their underlying malignancy. So in terms of our research, we have looked specifically at the interplay of two important domains in the progression of this type of malignancy. One of these is hypoxia and neovascular production. So this is a really important pathogenic trait that underlies the pathogenesis and progression of these malignancies. And the other is anti-tumor immune control. So we know that PD-1, PD-L1 inhibitors have gained success in the treatment of many metastatic malignancies, but in the specific setting of neuroendocrine tumor, there is lacking evidence. There is some evidence of initial activity, but the key question is to try and understand who amongst those patients could potentially respond best. So we have utilized a retrospective approach looking at over 100 patients with neuroendocrine tumors of various sites and various grades. And we looked at, in particular, at the interplay between the activation of hypoxia as well as the expression of markers of anti-cancer immunity, such as, for example, PD-L1 as well as IDO1, which are key traits that suggest the presence of an immune suppressive microenvironment. And what we found is that there is independence between these two domains, so that the expression of IF1 alpha and VEGF is completely independent from the expression of PD-L1 and other actionable drivers of anti-cancer immunity. And we think that this is really important because it might suggest that the two pathways progress in parallel rather than being interlinked. So we managed to prove the absence of an actual direct effect in vitro, so using cell lines which were exposed to hypoxia. And at the same time, we looked at the presence of circulating tumor cells in patients that were treated in our clinic, and we found that 75% of them had PD-L1 overexpressing circulating tumor cells. We think that this is quite interesting because those patients who had PD-L1 positive CTCs had more advanced more advanced disease and higher tumor burden, to suggest that PD-L1 expression might be important in the metastatic dissemination of these tumors.